Welcome to the Beef Cattle Research Council's webinar on managing calves to prevent disease. My name is Stacey Domaluski. I'm the Science and Extension Coordinator for the Beef Cattle Research Council, and I'll be your moderator tonight. The session is going to last for approximately 1 hour, but may go a little longer depending on the number of questions you have during the question and answer period at the end. If you're on Twitter, please tweet along with us tonight using #BeefWebinar. We are recording this session, and I'll email out the link to the recording to everyone that registered within the next couple of days. So if you missed hearing anything tonight or want to go back and watch it later, you can. Well, so for tonight's webinar, you'll be able to hear and see our presenters, but we can't hear or see you. So if you do want to communicate with us, type into the small chat window on the control panel on the side of your screen. If you have a question or comment for me or the presenter, you can do that there. And feel free to send questions in at any time, but we'll answer them towards the end of the hour. If your internet connection is a bit slow tonight, it might help to close other programs that are using the internet, as well as to close the webcam window. This means you're not going to be able to see us, but it'll hopefully make the audio come through a bit more clearly and get your slides to load a little faster. All right, so let's get started. So here's what we're going to be covering tonight. We'll start here from Dr. Claire Windeyer on managing calves to prevent disease. I'll then open it up to questions from you, and we'll end with some closing remarks and where you can find more information. So with that, I am pleased to introduce Dr. Claire Windeyer. Claire is a veterinarian, professor, and researcher at the University of Calgary Faculty of Veterinary Medicine. I started practicing veterinary medicine in rural southern Alberta before returning to the University of Guelph to complete her graduate degree. Claire's research focuses on cow-calf health management, perinatal care, calf health, pain, and animal welfare. So with that. So I just can't hear you, Claire. I still can't hear you. I think your mute is on still.
Okay, how about that?
There we go.
Sorry about that. So can you see my screen okay, Stacey?
Well, I can't see your screen yet. There we go.
Okay.
Perfect.
It's a very strange virtual world. Okay, how does that look?
Looks good.
Okay, sorry for that. It always goes smoothly during the trial run, and then when you're actually in the moment, it suddenly seems confusing and scary, so I apologize for that. Okay, so I'm good to go? I'll take that as yes.
Yes, you are, sir.
Okay, thank you. And thank you for Stacey for inviting me to speak this evening as part of your webinar series on managing young calves. It is one of my favorite topics, so it's fun to be able to chat with everyone in this strange little virtual world today. And so you guys tasked me with talking about calf management during the first month of life. And although I have to say I'm a little disobedient, I'm not going to stick to just the first month of life because it all kind of relates. But I did find it a little tricky because I presented on perinatal care and calving management last year, and so I was trying not to make this a repetition of last year, but I used up all my good insights last year. So hopefully I have some new ones, some other ones to share with everyone this evening, and that there will be some tidbits that people can take home with them and hopefully help them with managing calf health on their ranches. So with that, I have a little bit of an outline. I'm going to talk briefly about the major calfhood diseases, so we're all on the same page in terms of what it is that we're trying to prevent. I'm going to talk a little bit about some general principles of disease control, And then I have a few specific strategies that I hope will be useful for people in terms of ways to minimize calf foot disease. So just to put everybody on the same page, I'm sure all of you have seen some, if not all, of these diseases, but just to kind of put them out there. Of course, scours is probably the #1 disease that we think of when we're considering calf foot health problems. Septicemia is maybe one we think of less often, and I'll chat a bit more about what that means and what that is. Pneumonia is something that I think is, again, one of our major diseases. And then there's a whole host of other things that sort of happen a little, hopefully more sporadically, that we're not going to have time to get into today, but just to kind of make sure we've got them on the table. Things like naval infections, joint infections, injury, pink eye, foot rot, and a whole host of other things that didn't fit on my slide. I'm not going to talk about those tonight, but I think a lot of the principles are the same, right? So we know these diseases interact. If you're at risk for one disease, you're at risk for others. And those calves that become sick early in life often are the ones who become repeat offenders and become sick with other things. So they are all interconnected, and prevention strategies tend to help with all prevention of all of these different conditions to different degrees. So a few years ago, we did a management survey of producers in Alberta, although we did have some respondents from BC, Manitoba, and Ontario, and Saskatchewan as well. And we asked producers, among other things, what proportion of their herd did they treat in terms of different calf diseases. And so on average, we found producers treated about 5% of their calves for scours, about 3% of their herd for pneumonia, and about 1.2% of their herd for other diseases. But these are just the averages, so it's important to remember some herds did quite a bit better than this, and other herds were treating quite a bit more than this. So those are just the average numbers. We also asked them in terms of their herd level mortality to kind of benchmark that. And they told us that on average they had about 2.3% of their calves were dead at birth or within the first 24 hours of life. So that was definitely the highest risk time. In that first week of life, they were about 1.1%, and between a week of life and weaning, about 1.5% of calves died on average. And so I'm probably preaching to the choir here, but in terms of sort of emphasizing the importance of the impact of calf mortality in terms of herd level performance and the paycheck that we're able to bring home at the end of the day, I kind of wanted to plot out for different herds that would expect their average, have expected different expected average weaning weights at the end of their calf rearing period. What are the impacts of different herd level mortalities? So I hope you can see my arrow. Across this axis is herd level calf mortality. On this axis is the amount of increase in average weaning weight that a herd would need to achieve to compensate for the loss of calf life. So for every percentage of your herd that you lose, the rest of the herd has to pick up the slack, right? And so if you're down in this 5% relatively sort of low to normal calf mortality, to compensate for that in terms of pounds of calf that you wean, you need to be sort of 25 to 40%, pounds greater at weaning to make up for those lost calves. But if you're up here in these higher mortality levels, 15 to 20% calf loss, which hopefully isn't a common occurrence, but is sort of maybe where we get into some of these wrecks, the rest of your herd is going to have to weigh between 100 and 200 pounds greater at weaning, and really that's not going to be feasible, right? So what we want to try and do is prevent that mortality to make sure, because it's really hard to pick up that slack at the end of the day. So if we can prevent that mortality, we can maintain our herd level performance, and we can hopefully maintain a profitable herd. So Stacy, this is my first quiz question where we get to poll the audience. If you want to take the reins and run that.
Sounds good. So our first poll question here, this is your opportunity to participate with us tonight. So your answers here are anonymous to everybody else who's on the webinar tonight. So click the one that most applies to your operation. What's your biggest concern in terms of calf health? So diarrhea or scours, respiratory disease or pneumonia, calves that die without prior symptoms, or other. So you can go ahead and click the one that most applies on your operation, and I'll give you a couple more minutes here to get your answers in.
Will I be able to see the answers, Stacy? I can't see it right now.
I will see. So here's our poll results. Are you able to see them?
No, I can't see them.
If you minimize your screen, you may be able to, your presentation. So the answers here, I can read them out. So diarrhea and scours was the biggest concern, with about 48% of people saying that it was. Second was calves that die without prior symptoms at about 25%. Respiratory disease or pneumonia was about 20%, and other was 8%.
Thank you for reading those, because I did not see them. So I guess I'll have to get you to read them all out in the future. I don't know. Anyways, that's okay. Interesting that there was such a high number of people saying that they had calves that died without any prior symptoms, and I think that's probably something that when we do surveys and things like that, we maybe underappreciate those numbers. So interesting to hear that, and hopefully I'm going to chat a little bit about what I think might be going on with some of those cases, which maybe will give you guys some little tidbits in terms of what those cases may be. There we go. Okay. So I think number one, you did say, hopefully, if I'm not misinterpreting, I think the scours was probably number one in our survey. And so just a few details about scours, which formally we refer to that as neonatal calf diarrhea. And that's sort of defined as having feces that's softer than normal consistency or has higher fluid content than normal for at least 2 days. So if a calf is loose, sort of has loose stool for 1 day, that doesn't really count. And it can be caused by a whole host of various types of pathogens. It can be bacteria, virus, parasites, and often it's more than just one disease at a time, or one pathogen at a time that's causing the disease. So when we do herd investigations, we often come up with a number of different things that are contributing to the issue. As veterinarians, often we just see the severely affected animals. Those may come into a clinic, or we may get called out to see them. But I always tell my vet students that if they don't ask about the rest of the herd, they're doing their clients a disservice, because usually that really sick calf is just the tip of the iceberg. Rarely is there only one animal. Usually there's a lot of other animals that are either mildly or subclinically affected by the disease. And generally when we're investigating these things, it's less about what is the specific pathogen than it is about what are the risk factors that trigger the issue, because a lot of these pathogens exist, they're everywhere. They either are being shed by mature animals or they exist in the environment. So to really figure out how to control the issue, we need to investigate the risk factors more than sometimes worrying about the specific pathogens. And so saying that, here's a list of the pathogens. My point in showing you this is not so much about sort of memorizing details about what pathogens happen at what ages, which is what I make my vet students do, but for you guys, I just want to sort of point out that different bugs affect calves at different ages. So if we've got calves that are less than 5 days of age, it's likely going to be an E. coli issue, versus when we're up in here in our 3 weeks or older calves, often that's going to be a coccidia issue. And so the point just sort of being that if you are talking to your vets about a scours issue, it's important to tell them what age are the calves that are being affected. So keeping track of who you treat and how old that calf is may give some clues as to what pathogen it is, which may help target that control strategy a little bit better. I also want to point out quickly that a couple of these causes of scours are a risk to humans. Humans can get them. Some of you may have experienced these issues. I know it's we call crypto the vet student disease, because a lot of them will get that. So it is important when you are dealing with scours to make sure that, you know, people are washing their hands, kids and seniors aren't necessarily handling scouring calves, things like that. So just a sort of public service announcement on that one. So in terms of control strategies, really, when you get into these wrecks, it's often a little bit too late. You've got to try and sort of plug the hole, but preventing it is about sort of planning ahead, right? So at this stage, before calving season starts, having a chat with your veterinarian about what your treatment protocols are going to be helps you have that in place when you do start seeing cases, which can help prevent these problems from getting out of control. A few notes about sort of the disease itself. It's generally not actually the scours that kills the calves, it's the dehydration. So it's the fluid loss that is what kills the calves. So we need to address the dehydration if we want to prevent calf mortality. And so as a general rule, calves that are just mildly dehydrated, that still have a suckle reflex, so if you stick your finger in their mouth, they'll suckle on your finger, or you know, they're still sucking from their cow, but they maybe have some diarrhea. Those calves are in need of oral electrolyte solutions, so sort of our calf Gatorades. But it's important to note that not all of these products are created equal. Just because you can get some stuff that's cheap from the feed store doesn't mean it necessarily has all the things that your calf needs. So talk to your veterinarian about what are good products to have on hand. Calves that are flat out, that can't stand, that don't have a good suckle reflex, that are severely dehydrated, those calves are in need of IV fluids. So those are the ones where you really want to either take them to your vet or have your vet out, because they're going to need IV fluids if they're going to survive the dehydration. And so the question may be, well, how do I know how dehydrated they are? The calf on the left here, this calf has normal hydration status. So its eye looks pretty normal. There's no space between this eyelid and the eyeball, compared to this calf on the right, who's severely dehydrated. You could practically stick your finger in there between the eyelid and the eyeball. Those eyes are so severely sunken. So this calf is going to be at least 10% dehydrated and is going to need some IV fluids to be able to compensate for those losses of fluid. A couple more notes about treatment. This is something I think is a pretty common misperception among producers, and even I think among some veterinarians, that we treat scours with antibiotics. And really, because a lot of the causes of scours aren't actually bacteria, they're viruses or parasites, our antibiotics are not going to really treat the scours or cure the scours, which goes back to my point about we need to manage the dehydration more than the scours. But we do treat some of these cases with antibiotics, and that's really more about preventing the complications, and I'm going to come back to that in a minute and talk a bit more about what that means. There is some research that shows meloxicam can help improve the prognosis of these calves, so improving their appetite and maintaining their growth rates in a research study of dairy calves. But it is important to note that if you are going to use meloxicam in scouring calves, which is on label for the product, you got to make sure these calves are rehydrated, because we don't want to use NSAIDs, which is the class of drugs that meloxicam is. We don't want to use that in calves that are severely dehydrated. You can have some pretty negative side effects to the drug. So we need to make sure we rehydrate those calves when we're using meloxicam. And then another big part to help prevent these calves from becoming mortalities is the supportive care aspects. And I'm sure a lot of you have nursed these calves along and are familiar with the efforts of trying to keep them warm and dry. And it's also important, especially if you've got them in a warming hut or something like that and they're not with their mom, to make sure these calves are still getting some source of energy, because it takes a lot of work to fight scours. So they do need to continue to have some sort of energy. Septicemia is the next disease that I wanted to talk about, and I think that 20% of you that said you often see calves that die without any previous signs, and I suspect that some of those may be septicemic, and I'll explain what that means here. I do believe this is an underappreciated cause of disease and death in calves that we need to maybe chat a bit more about in terms of how to prevent and control this issue. And so what septicemia is that it's an inflammatory response to bacteria or bacterial toxins circulating in the blood. So that can be from scours, and I'll chat a bit more about that in a sec, but it can be from other sources as well. And so you get clinical signs that are a result of that inflammation. And so these calves can be depressed, they can be dull, they can be have a fever early on or be hypothermic as the disease progresses. They can lose their appetite. All of this probably sounds a lot like a scouring calf, but they may or may not actually have scours. So if you see these kinds of signs, but they're not scouring, that should clue you into maybe it's a septicemia case. Some of the other clues can be, if you look at their gums in these calves, we kind of describe it as having brick red gums, so the gums the color of bricks. And if you look at their eyes, the whites of their eyes will often have blood vessels that are visible and red and enlarged. That can be a sign that they're septicemic. And as these cases progress, their pulses become weak, their extremities become cold, although I think any calf in Alberta right now, as well as humans, dogs, cats, horses, everybody's got cold extremities right now as we're under a severe cold warning, and it's going to be like 40 below tonight. So cold extremities is relative. But these calves often get sick really quite quickly. So sometimes, as we say, they go downhill before you even really have a chance to clue in that something's going on. So the prognosis is often not that great, and they often need pretty aggressive therapy to survive. If they do survive, they may have some other issues that septicemia can lead to, including joint infection, pneumonia, or meningitis, if that bacteria in the blood then seeds into those other tissues. And so there's sort of two main scenarios that can result in septicemia. One is it occurs in younger calves, so calves that are less than 2 weeks of age that have failed to get enough passive immunity. So they didn't get enough colostrum from their mom. And so when they are exposed to an environmental challenge, particularly when that umbilicus is still open and wet and hasn't dried up and sealed over yet, these calves with failed transfer of passive immunity are quite vulnerable to that environmental challenge. They may have that bacteria seed up through the umbilicus and then circulate into the blood, and they can become septicemic. The other scenario that's not uncommon is in calves with scours. So these calves, they may or may not have a bacterial scours, but as that gut gets compromised, the gut lining gets damaged by whatever is causing the scours, that bacteria can travel across the gut lining into the blood circulation. So we estimate about a third of our scouring calves do end up with bacteria in the blood, and some of those will become septicemic. So that's a scenario where calves that have clinical signs of septicemia probably need antibiotics, definitely need antibiotics, because it indicates that they've got bacteria in the blood. So as I say, how we treat septicemia, antibiotic therapy, and you can chat with your veterinarian about the drug of choice, but ideally these calves are going to get antibiotics into the vein, right? So not given in the muscle under the skin, but actually given directly intravenously. So you may want your veterinarian to come out, or you may want to take the calf to them to administer that antibiotic therapy intravenously. There's no research that I've seen anyways in beef calves with septicemia on NSAIDs, but likely those are warranted. So something like Anafen or Banamine or Meloxicam or Metacam may be warranted in these cases. And again, the supportive care is going to be a big part of keeping these calves alive and making sure that they survive. So we'll keep them warm and dry, hydrating them if they need them, and keeping that energy in them as well. And then sort of last but not least, in terms of our major diseases that I'm going to chat about tonight, is pneumonia or bovine respiratory disease. And this can be caused, again, by a whole bunch of different pathogens. It's sort of a common theme with our calf foot diseases, right? So it may be viral and or bacterial. So sometimes you'll see the viruses come in first, makes them vulnerable to the bacteria, and so combined infections are not uncommon. And the clinical signs of pneumonia, as many of you probably know, these calves may have increased respiratory rate or effort or sound. They often have a fever. They'll be dull and depressed. They'll have reduced appetite, discharges from the eye and nose. Some of them may cough. And often these calves will just kind of look rough, right? They'll have that scraggly hair coat and not look as nice and shiny as the rest of their herd mates. And so similar to our septicemia, there's kind of two main patterns that we see in terms of pneumonia on cow-calf ranches. The first being sort of those sporadic cases that tend to happen in calves less than 30 days of age. And so we think that these cases are typically associated with failed transfer of passive immunity. So again, not getting enough colostrum. And then the other scenario that we often see are these outbreaks of summer pneumonia. And so a lot of herds will probably have never dealt with these, but the ones that have dealt with summer pneumonias have often had a bit of a wreck, and they can be quite a pain and can be a bit of a mess for the herd that do deal with them. And those tend to be more in those older calves, the 90 and up to 150 days of age, sort of more after turnout to summer pasture. And we think this is associated with a decline in maternal antibodies and a loss of herd immunity. And I'll come back to that a little bit later when I'm talking about control strategies. So that's sort of just a quick overview of the diseases. And ooh, time flies by when you're having fun. So to talk about some of the control principles in general, we tend to think about disease as an equation or a ratio between the amount of pathogen that a calf is exposed to and the resilience of that calf. And so if we kind of think about it as a teeter-totter, the thing that is in between those two ends of the teeter-totter is the way that we manage, right? So we try and manage to balance that teeter-totter in favor of the calf and not in favor of the pathogen. And so we kind of think about those three things as a triad: the environment, the host, and the pathogen. So the pathogen factors tend to be more about the load or the amount of exposure to pathogen, because a lot of the things that happen that cause calf foot disease are everywhere. As I mentioned earlier, they're ubiquitous. They exist whether or not we see disease, but if the load becomes too much, then we end up seeing problems. The host part of that, how we manage that host, things like colostrum management, nutrition, vaccination, can be things that we can consider in terms of managing that calf to maintain health, and I'll talk a lot more about that coming up. And then environment, so those are things like weather, wetness, crowding, stress are some of the environmental parts of that triad. And so mostly I'm going to talk about host tonight. We can spend a lot of time talking about all of these things, but there's only so much time. So in general, this again is probably preaching to the choir to you guys, because you've probably been thinking about calving season already, or maybe not, but having healthy, heavy calves at weaning really does take planning, right? We need to be thinking about this long before weaning time, way back to some of the earlier decisions that we make. So I like to think about as healthy, heavy calves starts with breeding and feeding, right? So making our breeding decisions in terms of what heifers we keep, what bulls we breed them to, what cows we cull, as well as how do we feed those cows over winter so that they have adequate nutrition and minerals, vitamins, all that good stuff, are really going to set the foundation for those healthy calves. And then we need to bring them into the world, right? That high risk period around birth, I mentioned the highest mortality being at stillbirth. So trying to get those calves into the world and get their feet on the ground is really when we can start to influence or continue to influence how healthy those calves are going to be throughout their lifetime. And so generally what we want are vigorous calves who can acquire that passive immunity, because we know that was a big risk factor that kept coming up in each of those diseases that I mentioned. And so we want to make sure that these calves get sufficient quantity, quality, and quality colostrum quickly and cleanly. And when you've got calves who look like this poor guy, we know that that calf is probably at risk, and we're probably going to need to help make sure that that calf does get enough colostrum. so that it's not sort of the bottom of the barrel in terms of your calf crop, and that it keeps up with the rest of its cohort. So next quiz question.
Right. So our next question here. So on your operation, when we pull a calf at birth, our typical colostrum management strategy is to, so the first one, give the calf a commercial colostrum replacement product, milk the cow and bottle feed the calf, milk the cow and tube feed the calf, put the cow and calf in a maternity pen and monitor them, or other. So go ahead and click the answer that most applies to your operation. All right. So just give a couple more seconds here. So it looks like the majority of people are putting a cow and calf in a maternity pen and monitoring them. So that's about 72%. 14% say they milk the cow and bottle feed the calf. 2% give the calf a commercial colostrum replacement product. 9% milk the cow and tube feed the calf, and 2% do something else.
So, okay. Great, interesting. Well, hopefully I think that sounds quite reasonable. I think you guys are all doing probably exactly what I would do, and hopefully I have a few little tips that can help make that process a little easier in terms of the monitoring of those calves. So we'll get to that in a quick second, just to talk a little bit first about the benefits of passive immunity, which I did talk a lot about last year, so I don't want to belabor it too much, but just to give us all a little bit of background. We assess the transfer of passive immunity, or that colostrum consumption. We can evaluate that by the level of antibodies, specifically the IgG antibodies, in the blood of that calf after it's consumed the colostrum. So we consider if they've got fewer than 10 grams per liter of IgG in their blood, that's failed transfer of passive immunity, so FTPI. But there's some more recent research from Cheryl Waldner at Saskatoon, where she actually looked at this in beef calves and found that really being over 24 grams per liter was what they needed to help reduce the risk of morbidity and mortality, so disease and death in those calves. So I think maybe our 10 grams per liter cut point might be a little bit low. We might want to be striving for something higher. And if you actually look at how many calves don't get enough passive immunity or a colostrum from their calves, 6% have absolute failure in Alberta and Saskatchewan in Cheryl's study, but another quarter of those calves had questionable levels. So I think we like to think of passive immunity as a dairy issue, but Cheryl had a pretty good sample size of a lot of well-managed ranches that still had a really high proportion of calves not getting enough of passive immunity. So I kind of beat my drum a little bit on this one, but I think it's something we still need to be paying attention to, and I think it sounds like a lot of you guys are already doing a good job of monitoring that. Oops. Okay, so we were interested in our research program about could we predict which calves are going to fail to consume colostrum within 4 hours, and we kind of picked 4 hours because that's the prime time to get that colostrum into calves. We wanted that in there as quickly as possible, and so we looked at a whole bunch of different things in terms of what predicts whether or not a calf is going to consume colostrum. And so one of them being, one of the most interesting ones being calving ease, right? So our unassisted, our easy assist being sort of a hand-pulled calf, and a difficult assist being using a calf jack or multiple people pulling that calf. You can see in this graph that with each of that increase in calving ease or decrease in calving ease, I guess, the proportion of calves that failed to consume colostrum went up. And so the risk of of failing to get that colostrum into them on their own without assistance increased with calving ease, which we kind of expected. But one of the other things, we wanted more than that. We wanted to say, okay, are there any sort of clinical signs or tests that we can do in those calves at birth that'll help us predict whether or not they're going to consume colostrum? And we did a whole bunch of different tests. And by we, I mean my graduate student, Dr. Elizabeth Homorowski, who did a ton of work on this. And you can see here, one of the sort of the best tests that she found was this suckle reflex. So if you put your finger in the calf's mouth like this, at 10 minutes post-birth, you can assess whether that calf has a strong suckle reflex or a weak suckle reflex. And it's pretty subjective, but you do a few of these and you get a pretty good sense of that. And she found that calves that had a weak suckle reflex were 42 times more likely to fail to consume colostrum. So we thought that was a pretty good predictor in terms of it's a quick and easy test that you can do right after the calf hits the ground. That's going to tell you, it tells you quite a bit about the risk of that calf failing to get up and consume colostrum on their own within 4 hours. And so we actually put those two pieces of information together and created a bit of a decision tree that I think can be useful for producers to use to decide whether they're going to do the, put them in a stall and wait and watch, or whether they're going to maybe go ahead and intervene and help that calf right away to get its colostrum. So we'll just walk through this quickly in terms of the decision-making process. So we started with calving ease. So we know that calves that were unassisted had a 14% chance of failing to consume colostrum on their own. Easy assist had about a 40% chance, and difficult assist had about a 64% chance of failing to consume colostrum on their own within 4 hours. If we add to that suckle reflex, we get some more information. So unassisted calves with a strong suckle reflex only had an 8% chance of failing to consume colostrum. So they're going to go ahead and they're going to do their job, and we probably don't need to worry about them too much. But we thought it was a bit interesting to look that even our unassisted calves, so these are calves that were born on their own, if you check their suckle reflex and it was weak, those calves had 78% of those calves failed to consume colostrum on their own within 4 hours. So that to me means that there's probably a group of calves that we assume are going to be fine, right? We assume unassisted calves are going to consume colostrum. They're not a problem. We'll kind of keep one eye on them, but assume they're going to do their job. But this suckle reflex tells us quite a bit more about the probability of those calves. And then the ones that we have our hands on that are a little bit easier to manage or to check are going to be our assisted calvings, right? Because those ones we're there, and we can easily stick a finger in their mouth and see what their suckle reflex is. So those easy assists that had a strong suckle reflex had a 26% chance of failing to consume colostrum. So that's not too bad. That's the sort of let's put them in the stall and wait and hope that they do it on their own, that we're not going to have to interfere and let the cow and calf do their thing. But if they have a weak suckle reflex, they have a 94% chance of failing to consume colostrum on their own within 4 hours. So to me, that's an indicator that maybe we should be getting in there and doing something sooner. So maybe, particularly if it's late at night and you want to go to bed, maybe that's a time where we should be milking out that cow and bottle feeding that calf if the cow is agreeable to that. The difficult assists, those guys, even if they have a strong suckle reflex, they've got a 50-50 chance. So especially if it's 2 in the morning and you want to go to bed, and you're not going to be able to watch those ones, those calves, there's a 50-50 chance, right? If it's the middle of the day and you're around, and you want to let them be and see what they do, then you know that it's a 50-50 chance. You can sort of use that information to decide what to do. But if the suckle reflex is weak, they're virtually 100% not going to consume colostrum within that first 4 hours on their own. So those calves, I would argue, probably need some assistance right off the bat, and there's not really much point in waiting. So hopefully that's a little bit of useful stuff that you guys can use to try and make some more informed decisions in terms of how you manage the colostrum in those calves, to try and help us all as an industry get that failed transfer of passive immunity rate down in our calves. And I guess just a few more things to kind of hammer why colostrum consumption is important. In Elizabeth's study, she did find that calves that succeeded on consuming colostrum on their own by 4 hours had a lower treatment risk and had a slightly higher average daily gain till weaning. It was a pretty small sample size, so I wouldn't necessarily take this to the bank, but it does help us sort of reinforce the fact that that colostrum consumption, even in a small population, a small study, can have health and performance benefits. Next quiz question.
All right. So the fourth quiz question, or here, the last quiz question here. So which best describes your calf vaccination strategy? So the first one here, we don't vaccinate our calves. We vaccinate within the first week of life. We vaccinate at spring processing or branding. We vaccinate prior to weaning, so less than 3 weeks or at weaning. And we vaccinate pre-weaned calves multiple times. So pick the one that most applies to your operation, and I'll give you a couple more seconds here to get your answer in. So it looks like there's just a couple more answers coming in. I'll give you a couple more seconds. All right. So 49% say they vaccinate at spring processing or branding. 12% vaccinate either prior to weaning or at weaning. 12% also don't vaccinate their calves. 17% vaccinate pre-weaning calves multiple times. And 10% say they vaccinate within the first week of life. Oh, and your mute's back on there, Claire.
There we go. Okay, sorry. I didn't want you to hear me slurping away at my water. That's really interesting. That's actually a lot higher than I would have expected. So that's pretty exciting. This is where it's unfortunate that you guys are all in a little black box that I can't talk to, because I'd love to know more about what products you're using and all of that. But I'll go ahead and tell you what I have to say anyways. And that may or may not influence what you're already doing. I'm quite impressed with the amount of vaccination that's happening out there. That's really great. The last time that I presented on calf management, that was the biggest. All the questions at the end of the session were all about vaccination. So I wanted to make sure I covered that this time around, because I think it's something that people have a lot of questions about, and I don't want to steal the thunder from Nathan in January, so I won't sort of cover everything, but I wanted to talk specifically about some principles about calf vaccination, because I think that's a big part of our disease control strategy. Generally, you know, this is something that people always want to say, how do I vaccinate my calves? And I always have to kind of say, well, I don't know, because it depends. I do like to tell people that colostrum is the best vaccination a calf can receive. But really that's not the whole truth, and it really depends on the individual ranch. And there's really never one size fits all vaccine strategies. And I guess that's probably somewhat demonstrated by the diversity of responses to that survey question, that a lot of people are doing different things. And I'll chat a little bit about when I think what strategy is appropriate depending on some of the things that are going on your ranch. So it depends a lot on the maternal antibodies, right? So it depends on what those calves have to begin with, and it depends on what the disease challenge that they're facing is. It's also influenced by when your calving season is, the timing of your handling events, and the destination of those calves. And I'll talk about those things a little bit in a few more details. And really, as you guys probably have already thought about, the planning of this starts long before calves are born, right? Because you need to be thinking about how to vaccinate your cows, because that influences how you vaccinate your calves, and how you market your calves influences how you vaccinate your calves. And all those things are interrelated. So it's sort of not a, oh, we're going to brand tomorrow, let's go pick up some vaccine. We probably should be thinking about these things long before that day occurs. And I guess I'll do a little public service announcement for Nathan, and he is presenting on vaccines in January. So I encourage you all to attend that to get a whole bunch more information about vaccination. And I realize I'm running short on time, so I may have to skip through a little bit. And I think I'll probably skip this one because that takes quite a bit of time to explain, but hopefully I can still make the same points. So a lot of you may have read the labels on the vaccines that you purchase, or maybe not because it's hard to read. They make it in such tiny fine print that it's virtually impossible. But if you have read it, you may have seen that it says calves that are vaccinated before 5 or 6 months of age need to be revaccinated after 5 months of age, or 6 months of age, depending on the product. And that's because a lot of the injectable vaccinations are unlikely to be protective in young calves, because the maternal antibodies that hopefully the calves have acquired through their colostrum can actually block the response to that vaccine, because essentially a vaccine is like a mini disease challenge. If you have a lot of maternal antibodies in your system, your body takes care of that disease challenge, and so the calf's immune system never really has to respond to that vaccine. So those maternal antibodies can interfere with the response to an injectable vaccine. However, in the last several years, we've had intranasal vaccines that have come out into the market, and there's been a fair amount of nice research on it that's been able to show that those intranasal vaccines may actually generate an immune response within the calf, even in the face of high levels of maternal antibodies. And there's a few caveats to that I want to mention. The intranasal vaccines that we have in Canada are only for the pathogens that cause respiratory disease and don't have BVD in them. And so they will not prevent scours. I recently had a conversation with a producer who was quite disappointed that his at-birth intranasal vaccine protocol hadn't fixed his scours problem. And so it's just important to note that that's not what you expect them to do. They don't have the pathogens in them that would prevent scours. So it comes back to some questions that we'll talk about here in a moment in terms of what are you trying to achieve with your vaccination strategy, and making sure you tailor that to your herd. The other neat thing that we've seen with the research is that some of these intranasal vaccines can actually prime the immune system to better respond to future vaccines. So in the research projects, they'll give these intranasal vaccines, and sometimes they can't measure, antibody responses necessarily, but when you revaccinate those calves later, it's like they've been previously vaccinated, and so they have that sort of memory response to the vaccine, like a booster, even in the face of maternal antibodies, which our injectable vaccines won't do. So it's pretty exciting that we have these products available to us now. So some of the questions that we should ask ourselves, and you guys should be discussing with your veterinarians as you're making your plans for your calf vaccination strategies, there's a few of them. So one being, when are you seeing calf foot disease? So what time frame are we worried about? What is the primary disease syndrome you observe, right? So we've talked about scours, septicemia, pneumonia. Which of those is the biggest problem on your herd? When do you handle calves, and when could you administer a vaccine, right? So if you don't handle calves at birth, and the first time you touch them is spring processing, well, an at-birth vaccination strategy is not going to work for you. So thinking about when is convenient is an important part. And then really, what is the goal of your vaccination? How are you going to wean and market these calves? It should be a part of what is going into your decision-making around your vaccination strategy. So if your primary disease issue is scours, you probably want to be revisiting your pre-calving vaccination strategies for heifers and cows, and I'll leave that one for Nathan. But really, your calf vaccination is probably not going to be your primary strategy. You're going to need to be thinking about how to get those antibodies into the calf through the cow vaccination, and then your colostrum management strategy. And really the number one thing for scours prevention is going to be environmental management. And I don't think I'm going to have time to get to those slides, unfortunately. We could talk about that one probably all night. So if you guys have questions, we can talk some more about environmental management. If your primary disease is pneumonia, then the next question to ask yourself is, when is that occurring? Is it that early calfhood pneumonia, which again is probably more of a colostrum issue? Maybe we're going to consider an at-birth intranasal vaccine, especially if you've got high mortality, right? So if these calves are getting so sick and dying before you have a chance to be able to treat them, then, or your treatments are sort of too late to be able to save them, then that might be a situation where an at-birth intranasal vaccine might be helpful. If you're dealing with more the later summer pneumonias, then that's a situation maybe where we want to consider a branding or spring processing intranasal vaccine with or without an at-birth intranasal, right? So I think vaccination is often cheap insurance, but at the same time it comes with a cost of handling, labor, all that kind of stuff. So only adding in that at-birth intranasal vaccination if you really feel like you need it because you're dealing with a fair amount of that summer pneumonias. And then the other big question is whether you retain ownership or sell your calves direct. So how invested are you in the post-weaning health of these calves, and how much you want to put into them prior to weaning and sale. And so this stuff comes from Dr. Philip Griebel from Vito, and they've done a bunch of nice work on this. And so his research shows that intranasal vaccination at spring processing and at weaning can result in some nice immune responses during that post-weaning at-risk, high-risk period that can reduce clinical disease, reduce mortality, and reduce the virus shedding. So, so getting at them earlier before weaning can really have some nice post-weaning benefits. He's also shown that intranasal or injectable modified live viral vaccines pre-weaning, so that more than 3 weeks before weaning, can have a similar impact in terms of reducing that post-weaning disease. But that injectable vaccinations at branding and weaning didn't have that same protective effect. So I think we're really lucky to have these intranasal products available to us in recent years because it's giving us some more strategies to be able to get that post-weaning immune responses that I don't think the injectable products quite are able to deliver. So just to sort of reiterate that management triad, because I think disease prevention is never a one-trick pony. There's always a bunch of different components that come together to maintain calf health. And so I've only really struck on the host aspect this evening, but keeping in mind all three parts of that triad can be really important in terms of managing calf health and preventing disease. So I'm going to have to skip all of this wonderful management stuff that I wanted to talk about, but I did cover a lot of it last year as well, unfortunately. But I want to save time for questions. So just a couple take-home messages. Preventing calfhood disease and calf losses, as you guys I'm sure know, takes a lot of planning, right? So I think the herds that do really well in terms of calfhood disease, they are thinking about this stuff year-round, and they're really trying to think about that ahead of time. Rather than trying to put out fires once they've started. So I think having these conversations this time of year is probably a great time to be thinking about it. Ensuring colostrum consumption really ensures that good start to life, and I think puts those calves starts their life off sort of on the right foot. So using calving ease and suckle reflex to assess the risk of those calves is hopefully something that can be useful to you guys. I think intranasal vaccinations may be a useful strategy for some herds depending on what they're dealing with and what their goals are. And then the environmental management, I think, is a big part of trying to help tilt that balance. So thinking back to that teeter-totter, tilting that balance in the favor of the calf. So I'm sorry I had to skip that stuff, but such is the ticking clock. So with that, I will take any questions, and my email is there. If you want to follow up with me and have particular questions, I would love to hear from anybody. So don't be shy. Fire me an email if you have questions. I'll try and answer them if we don't get to them tonight because I talk too much. Stacy.
All right. Thank you very much for that, Claire. So that was a great presentation. So as she mentioned, we will now open it up to questions. So you can type your questions into the chat panel or question panel on the side of your screen. And I will read them out. If your control panel has closed, you should see a little orange arrow somewhere on your screen. If you click that, it will expand it, and you should be able to see questions from there. So we do have a couple questions coming in already, so be sure to get typing there. So our first question here, is it okay to give calves colostrum from dairy cows?
That is one of my favorite questions, actually. We've done some work looking at the quality of beef colostrum compared to dairy colostrum. And on average, even our heifers generally have more than 150 grams per liter of IgG in their colostrum. And the dairy guys would consider 50 grams to be adequate. And so their quality of colostrum that we can get from dairy is not even close to what our calves are used to getting from their own dams, or what they would expect to get from their own dams. So often the quality of the dairy colostrum is really, really poor. And the other thing that I really worry about with the dairy colostrum is disease transmission. And we know that Johne's disease is very prevalent on dairies in Alberta and across Canada, really. So I worry about the things that we may bring into our beef herds if we bring in dairy colostrum, or dairy animals, even worse. And so, not that I have nothing against dairy animals. I love dairy animals. I just don't like seeing them on beef herds. And so, there's some really great colostrum products, commercial colostrum products that are available that are high IgG concentration, that are have been sanitized and are much safer, much higher quality. They, of course, come with a greater cost. But I think if you consider what a weaned calf is worth, that investment at birth is probably worth the time and effort. So yeah, I would avoid the dairy colostrum if at all possible, but I know that's not always feasible, but it's not it's a bit of a Trojan horse, I think.
All right, thanks, Claire. So we have lots of questions coming in, so be sure to get them in as soon as possible, because we may have to cut off a little early. So the first one, or next one here is there any more research on iTeam?
On iTeam? Oh, wow. That one's out of left field. Well, I guess not really. It's interesting. Oh, we could go, that's a bit of a tangent, but it's interesting because I feel like iTeam has kind of come full circle where I guess for one, it's quite a bit more common in the feedlot than it is in cow-calf, and I think we saw a lot of those iTeam cases that were, neurologic, joints, all of that part of that syndrome, and then it seemed that those kind of went away, and we were seeing more of the cardiac issues with iTeam, where we had the classic heart lesions. Although in the last few years, I've heard people say that they've been surprised at the number of iTeam cases that they've been seeing again. So I'm not sure that's answering the question per se. Yeah, I'm not sure, to be honest, in terms of what's the recent research, particularly in terms of cow-calf. I think, sort of bigger picture philosophical questions, there's not a lot of research on respiratory disease in cow-calf, period. There's not a lot of scientific literature when you go looking on even what are the most common pathogens that are causing it. A lot of it we kind of extrapolate from the disease syndrome in feedlots or in dairies, but it's sort of on my list of to-dos to actually look at what are the pathogens, what are the most common bugs causing respiratory disease in cow-calf, because there's actually really not any literature out there. There's very little literature out there, and nothing in terms of Canadian literature that I've seen recently. So that was a long-winded way to not answer the question, I think.
So the next one's here. I have a couple people asking about how much colostrum should you be giving a calf, and like in liters, and how often would you recommend feeding colostrum to calves that need it?
Great question. Yeah, and I could have talked all night just about the colostrum stuff, but I really covered that in depth last year, and I think that's online. So if people want to hear more of me, which I don't know if they will, but if they want to hear more about colostrum, there's a whole hour-long talk about that on the BCRC website. But sort of my rule of thumb is that beef calves, if they haven't sucked, should get at least a liter in the first 4 to 6 hours. Followed by hopefully sucking from their dam, and if they don't, another liter within the first 12 hours of life is sort of my rule of thumb, and we can talk about all the details of why that is, but that's sort of the distilled version. So 1 liter in 4 and another liter in 12.
And I will be sending out a follow-up email to everybody who registered with some supplemental information, and in it will include the link to the past webinar Claire did with us if you weren't able to watch it.
Cool.
So the next question here, is navel ill an indication of poor passive immunity?
I'm sorry, I have a sneeze coming. That's horrible timing. Is navel ill a sign of poor passive immunity? Was that the question?
Yeah.
Yeah, and I think it can be. It's a bit of a balance, right? So if calves with poor passive immunity are exposed to even a little bit of environmental contamination, they may end up with joint ill. On the flip side, calves with very good passive immunity, if they get exposed to a really dirty environment and they have, they don't have that good umbilical shroud, it was ripped off right against the body, things like that, then even a calf with adequate passive immunity may still end up with navel ill. But especially if you have a lot of calves with navel infections, it's going to be one of two things. It's either the environment's really dirty or the calves don't have enough passive immunity.
All right. Next question here. How young should a calf be vaccinated for blackleg?
That is also a good question. Again, it depends a little bit on colostrum because ideally our baby calves should be protected against blackleg relatively well because their dams should be well vaccinated against blackleg. So ideally those calves should have good maternal antibodies against the clostridial diseases, but especially when we're getting into castrating, branding, dehorning, some of those things that are risk factors for our clostridial diseases, I think it warrants having a vaccine on board at or before those events.
All right. Next question here. What do you think about sending a scouring calf sample to a lab?
Yes, I think it is very helpful. I think the one sort of caveat to that is a calf sample is probably not enough, because if you think back to the fact that there's generally multiple pathogens involved, often we need many or multiple calves fecal samples to send to the lab, right? So to really get a picture of what's going on, we often need more than one sample. So the sort of best samples are calves that are acutely sick. So as soon as they get sick, before they get treated, grabbing some manure from those calves. Sort of the best diagnostic, although it's not ideal, is a freshly dead calf, particularly one that wasn't treated. Those are going to give us the most information. But yes, I think fecal samples can help us definitely target or tailor our control strategy to a particular type of pathogen, but one is often not enough.
All right. So I've got two more questions coming in here. So if you do have a question, make sure you type it in right away, because if not, we'll wrap up after these two. So do you have a preference for bottle feeding versus tubing?
Another good question. Yeah, and we don't know for beef animals. Nobody's done the research. It's also on my to-do list. But in dairy calves, they've shown that you get, if in with small volumes of colostrum, you get better absorption with bottle feeding, because essentially there's a closure of what we call the esophageal groove. So when a calf sucks, it sort of it closes that groove so that the milk goes straight into the abomasum, or the true stomach, because these calves aren't ruminants, right? And we don't want the milk going into the rumen, we want it going into the abomasum. So when they suck, that kind of goes directly into the abomasum. When we tube feed, they don't have that same suckle reflex, and so that volume, that colostrum we give can actually kind of end up in the rumen. And if the volume's not enough, that's where it ends up. If you give them enough volume, it'll overflow from that pre-ruminant rumen into the abomasum, and you still get adequate passive immunity. And so in dairy, they say, 4 liters of colostrum by tube or by bottle, doesn't matter. 2 liters, the bottle is better. The problem with translating that to beef is that our volumes are so much lower when it comes to beef colostrum. I don't want to put 4 liters of colostrum into a baby Angus calf. It's going to never stand up and drink from its mom, or it's not going to do that for a week, because it's going to be a big fat tick, right? So we don't want to overstuff our newborn baby beef calves, because we want them to get up, get moving, suck from their dam, and go on about their business. So the volumes we give our calves are lower. The concentration of the colostrum should be higher, but nobody's actually looked at the impacts of bottle versus tube with beef colostrum in beef calves. So we don't know if the same holds true for our beef calves. So to err on the side of caution, I guess, sorry, I'm wandering, but to err on the side of caution, I always prefer trying to bottle feed first. But I know how much patience that takes. I make all the vet students bottle feed babies because I think they need to know how frustrating that is. So if you can get them to bottle feed, then that's always preferable. Or I believe that's preferable, but if they won't drink from a bottle, then a tube is better than nothing, right? I would rather them get tube fed some colostrum than it be 12 hours later and they still haven't sucked. So I guess, again, a long-winded answer, but yeah, I try and bottle feed them first. If that fails, then tube them, and I'm gonna try and get some research money to look at that eventually. It's on the list.
All right. So the last question here, unless somebody types one in really quick, how does purchased colostrum compare to milking the dam for colostrum?
Yeah, that's a good question. And I think the challenge sometimes is around volume. So especially when we're dealing with heifers, it's sometimes hard to get enough colostrum out of those heifers, particularly if they're stressed, if they're kicking, if they're unhappy with you. It's hard to get enough out of them. I think there's benefits to fresh maternal colostrum that are sort of above and beyond the IgG. So there's cells in there, there's calories in there, there's vitamins and minerals in there. So I do prefer maternal colostrum if it's available in enough quantity. But if you've got a heifer that'll only give you a half a cup, then I think your commercial products are going to be necessary. So I think they're a tool to have on hand. I think they're important to have as backup, but I do prefer trying to get it from the dam first if I can.
All right. So with that, there's just a couple more things we want to let you know about before you go. So the first is how you can get more science-based production advice through the BCRC. So you can go to our website, beefresearch.ca, and click the subscribe button to sign up for our free email list. If you have a Twitter, YouTube, or Facebook account, you can follow us there as well. And So don't miss our next webinar. Claire's already talked about it. We'll be talking about economic vaccine protocols, so a great addition to this one. We also have 4 more webinars coming up this year, and you can register for them all on our website, beefresearch.ca. So very shortly, as soon as this webinar ends, you're going to be asked to complete a short survey that asks about tonight's session and what you're most interested in for future webinar topics. We do need your feedback to do the best job we can to deliver information that's both useful and meaningful to you and helps you make informed decisions on what's best for your operation. So please complete the survey and don't hesitate to contact me if you have questions, comments, or suggestions at any time. You're also going to receive an email from me, as I mentioned, within the next couple of days. It'll have a link to watch the recording, as well as links to some additional information on controlling calf disease. So watch out for that. So that's it. So I'd like to thank all of you at home for joining us tonight. And on behalf of everyone, thank you, Claire, for volunteering your time and expertise tonight. So good night.